Remember, your vote determines your future success. Global healthcare comparison. United States, a hybrid multi-payer. The U.S. combines private insurance with public programs like Medicare, Medicaid, and reforms under the Affordable Care Act. Spends the most per person in the world. No universal coverage. High out-of-pocket costs and medical debt. Strong innovation in specialty care. Despite record spending, U.S. life expectancy trails most peer nations. Canada, single-payer public insurance. Universal hospital and physician coverage. Lower administrative costs, some longer wait times. United Kingdom, government-run model. Through the National Health Service, care is tax-funded and free at the point of service. Universal coverage, lower costs than U.S. Budget and staffing pressures. Germany, social insurance, universal multi-payer. Mandatory nonprofit insurance funds, shorter wait times than many systems. Strong cost regulation. France, hybrid universal. Public insurance plus optional supplemental coverage. High patient satisfaction. Broad access at lower cost than U.S. Japan, regulated universal system. Mandatory enrollment. Strict national price controls. One of the highest life expectancies globally. The pattern? Every country above guarantees universal coverage. All spend less per person than the U.S. Most achieve longer life expectancy and fewer preventable deaths. The difference isn't medical capability. It's pricing control, coverage design, and access structure. Inequality inside the United States. Healthcare outcomes vary sharply by race. Black women face significantly higher maternal mortality. Indigenous communities have lower life expectancy averages. Minority communities often experience higher rates of chronic disease tied to access and structural inequities. Income. Lower-income Americans delay care more often due to cost. Medical debt disproportionately affects working families. Region. Southern states often show higher uninsured rates. Rural areas face hospital closures and provider shortages. Wealthier metro areas have broader access to specialists. In America, healthcare quality often depends on your zip code, income level, and insurance status. Why healthcare matters economically. Health fuels productivity. Productivity fuels economic growth. A healthier population misses fewer workdays, requires fewer emergency interventions, reduces long-term public spending, strengthens national economic stability. Many economists argue that preventive, accessible care lowers total long-term costs and supports a stronger workforce. Civic power in healthcare. Healthcare systems reflect policy decisions, funding levels, drug pricing rules, Medicaid expansion, and insurance regulations are shaped by elected officials at state and federal levels. Civic participation determines which healthcare priorities move forward. Low participation means fewer voices shaping major policy decisions. The bottom line, the United States spends more than any country on healthcare. Other advanced economies provide universal coverage at lower cost. Within the U.S., race, income, and geography strongly influence health outcomes. Healthcare is more than treatment, it's economic infrastructure. A healthy population strengthens families, communities, and national prosperity. Vote for the right to healthcare, for you, your loved ones, and your unborn generations.